Hey, this is Matt Urtz, the Madison County historian. We are still working to document how the COVID-19 pandemic has impacted different people, places, and things. And since semesters for some of the colleges have ended, we are very excited to have Bob McVaugh with us again to talk about how Colgate did and what they learned and what they might do in the spring. Bob, thanks for being with us.
My pleasure.
So let's start with the last time we talked about the two things you hope to come out of this was you hoped that you were aspirational, which I think that was definitely the case, and you hope you came out of it with great pride in how you were able to succeed. Do you think you're coming out with great pride with how you guys did?
Um, I think so. It's easy in our environment today to, read everything in terms of publicity, and we have gotten some publicity. Brian's been on the TV, and so is Paul, and those were all wonderful moments for us. But I think actually in a recent meeting of the task force, and just to remind everyone, I'm on a task force which is made up of faculty and the dean of the college, Paul McLaughlin, and the vice president of campus of safety and emergency services, Dan Goff, as well as a trustee member. And I want to underscore that the trustees have been, I don't want to say hands-on in the sense of being intrusive, but hands-on in the sense of being totally supportive of the efforts of the institution. And we're very fortunate in that regard. But at any rate, the group that we were talking about the semester, and in some ways we almost created a challenge for ourselves because we did so well in the fall relative to so many schools that we were actually discussing the testing regimens for the spring and whether we should increase the testing regimens. We can get some of this detail later, but there was a sense, and it was shared by the board, that the stakes are actually a little bit higher now because having succeeded, I would say dramatically, we don't want to mess up the second term. And that presents a number of challenges. And one of the ways we may face that challenge is, as I just mentioned, increasing our testing regimen, not because the one in the fall was not successful, but because everyone anticipates that the environment in which we will start and the season, the winter season, will make the challenges so much more acute. Late January, February, we still anticipate very high rates regionally and nationally. So, but that's an indirect way of answering your question, is that we feel that we did not a perfect job. There are things that we can do to make it better, and we can talk a little bit about that, but that we succeeded. And I guess trying to get a sort of summary here in the front, we succeeded, I think, for two reasons, or two classes of reasons. One, we were driven by data, driven by science, and up and down. All levels of policy were shaped that way, which was difficult to do given the public discourse of the fall. And the so that was one. And the second one was that there was I was thinking about it actually, in my 40 years here, I never remember a time in which there was a greater kind of coordination between all levels of administration and all levels of the staff, faculty, and students, although there's always the challenges of the 20-year-old. But it was is a collective effort. Of course, there were some aberrations, but and we can talk a little bit about how a challenge would come up, and across the board, people would volunteer to address it. And that was a wonderful thing to see. So it wasn't just people being told what to do. It was generally an environment in which the word went out what needed to be done. And then staff, faculty would step up and, for example, volunteer. I'll give you a case that I was thinking of. Right before Thanksgiving, the governor, I thought very, very wisely, or the state, I shouldn't say the governor, but the state anticipated that the return of students to their homes would be a potentially dangerous event. And so they distributed very, very widely antigen tests, which we were not using, but they made them available so that we could make available tests for all students on their way home before they went home. We had about a 1 week window. How do you set up to test 3,000 students in 1 week? The medical staff stepped up, the coordinators stepped up. Many of us, I volunteered for a morning to be in the room and being part of the team to test it. And that just happened. And it doesn't always happen. So we really did, I think, rise to the occasion.
Okay, so I'm going to kind of tell you a story. Hamilton has a very big farmers market that takes place during the summer, the spring, summer, and fall. And I try and hit it up there, partially because I've worked with a number of the farmers and partially because I try to support local. And I was driving through there, I'm going to guess very early September, because there was still a lot of short shorts and, people, in playing Frisbee and tank tops. And I remember thinking to myself as I drove past the campus, I can't believe every student is wearing a mask because of where we've been as a country. And it boggled my mind. I saw people jogging with no one near them and they were wearing masks, which made me beg the question, how did you get students to wear masks?
There are lots of pieces of an answer to that question, but, and I'm not up for a raise or anything. I need to put a lot of that on Brian Casey. Brian's decision to quarantine with the students and chat with them every afternoon about the food, about the circumstances, about the challenges of being stuck. He quarantined not in his house. He quarantined in a dorm room.
Yeah, my wife called me one morning and said, "Do you know the president of Colgate's on Sunday morning?" And I ended up finding it, and that is now part of the Madison County archive of videos that we have that's part of this. So sorry.
Well, and what that was it was a confirmation, and certainly the faculty, up and down the faculty, the notion was, and staff, if you were here, if you were on campus, you wore a mask. That was the expectation. Indeed, there were some members of the community that I saw who, when they were on campus, they wore a mask. When they were out walking around their neighborhood, they might not have. But, and it was a sense of modeling for the students that this is not something you do when you have to. You go beyond what you have to do, because you never know when somebody's going to be walking past you from behind that you didn't hear, and suddenly you're within proximity to them or something like that. There just was a sense of, okay, this is what we're going to do. And I actually think when you were here in that early phase, when the students were in quarantine and exercising outside, or first getting out of the quarantine, some ways they were modeling positive behavior for the community.
Right.
I was actually, my sense was that the students, for about a month anyway, were more rigorous in respecting safety procedures than some of the village population. And that's okay. The way that we get through it is that people are always modeling out there. and always pushing a little bit beyond. Yes, you don't have to wear a mask when you're jogging, but why not? Yeah, it's uncomfortable, but is that really a reason why you would put others at risk? And so I'm glad you had that observation. And there were many of us that were really quite surprised at how well the students embraced it.
So as you guys came into this plan, some of the things you had in place, you mentioned everybody quarantines. Doesn't sound like you had a lot of issues with that. You purchased the hotel kind of on the edge of town. That was going to be your isolation space. You had Colgate Inn, who was providing food when necessary. And I think they provided food during the quarantine period as well. Once the students got out, talk a little bit about, there was no way this went exactly as you planned. Talk about some of the adaptations you had to make on the fly as kids start to maybe get sick and show signs, or kids start to go, I'm not sure I want to do this the way they're doing it anymore. Talk about some of the things that happened that forced you guys to go, okay, we got to change something here for the better.
Well, I think I'd want to back up just a little bit. I think the quarantine, quarantine sounds like a simple thing, but it is not simple at all. And we learned, for example, the mail deliveries to rooms, the logistics involved with all of the shipping that came in for 3,000 students was beyond the physical capacity of our post office. And so we had to build, and these were the kinds of things we did on the fly, is we built support spaces. We extended the support spaces for some of those services. A huge issue when the students came, of course, getting the meals to them was, well, imagine trying to deliver 3,000 meals without, and so the logistics of that were extraordinarily complicated. And I want to give a shout out. The athletic department, basically, they didn't do it all, but they did yeoman service. All members of the athletic department, there wasn't a lot they could do. I mean, they can do some recruiting and they can do some administrative work, but and I don't want to trivialize that, but they stepped up to help deliver those. And they kind of provided an example for a lot of other people that, somebody else isn't going to do this for you. You have to get it done. And so that it set a tone, I think, that the quarantine, not just that we talked about people enduring uncomfortable circumstances, but people actually volunteering to create an alternate normal. Now, everybody was so delighted when quarantine was over. And we went into what we called Gate 1, which was also very, very restrictive. It basically meant that students could go to classes and not much else. There was no travel between dormitories. So you only could visit folks actually on your hall. We had a staged kind of release from quarantine. Quarantine was gate 0. Then we went actually through ultimately 4 gates, and each one allowing a little bit more freedom. The first ones, basically, you could go to classes or to required activities, but no socializing outside. And then they could socialize outside in the next step. And then larger groups could socialize outside. So it wasn't, I think that was one reason that it was successful, is that each stage was a reward to the students, but no stage was a return to normal. So the idea was not, well, now we're back to 2019. And so there was a small minority that fought it. We had we had a case of some folks who kind of just deliberately disregarded what we called the commitment to community health, which they all had to sign, and they were dealt with quickly. That was another key issue. It wasn't, oh gosh, we're going to give you 5 chances of egregious behavior before we ask you to leave campus. They left because what they did was so obviously disregarding the safety of others. That was it sounds harsh, but and Lord knows the dean got some very, very serious blowback from parents and students, but it was a crucial element, and students were very aware that that had happened. So that kind of kept them in control. The group that I think had the hardest time was first years, because they really, they didn't have a kind of tradition of balance. So they're, of course, always testing. First years are always testing. And so there were some occasions where some foolish behavior took place.
Well, some of that got covered in local news too. Another university, we'll just say in central New York, had an incident where a whole bunch of kids met right out in public in a massive gathering place. And there was lots of photos and lots of videos, and it became, a pretty large news story in the area. And the same situation happened. It sounds like that place came down pretty hard. And then there was a lot of questions of why are they coming down so hard? And yeah, I mean, it's a line you got to try and straddle, and it's hard.
Right. And I will give kudos to campus safety. We had some cases where, and particularly the first year group that I mentioned, they went outside, and yes, they were outside, and they probably thought they were social distancing, but they really weren't. And so campus safety would come in and say, yeah, you got to change behavior here. And that was okay. It wasn't a one strike and you're out. But if they did it several times after being warned, then it was, well, wait a minute, you're simply breaking what you understand and what have been justified as practices which are essential for keeping this place safe. I think we succeeded. This is a little bit of a shift. Well, no, you set the agenda. You go. I don't want to.
Go ahead. Go ahead.
I mean, I think we succeeded because of our testing, our quarantine. Those 2 instruments allowed us to create a bubble. And also, and this is a kind of irony, many of the faculty, for example, many of the staff that could work from remote, and faculty who felt that they might have particular pre-existing conditions so that they'd be at risk. In some ways, they were encouraged to teach from remote, but one of the results of that was that we didn't have a lot of movement of personnel outside Hamilton back and forth. There are, of course, many who did, and many had to, particularly within the staff. And we were very aware of that. But it was the bubble that got us through. It wasn't any particular, righteousness of Colgate students, or it was that we tested extensively early. We identified those who brought it, and then we minimized travel. This is one of the policies that the students resented the most. You were not to leave town. If you left town, you were supposed to register. You were supposed to make arrangements. You were supposed to be, there was testing involved. Your parents were not supposed to come. They were not supposed to visit. This is a very hard thing for 21st century families to hear.
Especially for first-year students, I'm guessing.
For first-year students, I've often thought this semester about what it would have been like, when our boys went, because we visited them several times. It was for us as much as for them, I think. But we just cut that off, and it was indeed the places where we had problems and cases, and we had very few, were mostly associated with travel once we got the bubble established. And so it also, people continued to wear masks, but and that was part of the culture if you were on campus. But in many ways, what I think really saved us was our isolation.
Right.
And we're a little distinctive in that sense.
Okay. So we really briefly touched on it last time, but it's become kind of more of a news story because of the shenanigans that are going on with it. You guys canceled fall sports, and we're now into the winter sports phase, which I believe you guys are doing conference only. We have a lot of
very
colleges.
limited conference.
Okay.
Very limited. Okay, go ahead.
So we have a lot of programs. Obviously, the winter sports basketball is the one that's probably the most on the news and TV. But we do have a lot of programs where there's been the news clips of they're pausing, they're shutting down for a few weeks, they're doing this. How are you going to make this work? Because again, winter sports, and just leaning on basketball to a lesser degree, probably hockey. I don't know so much about volleyball or some of those, but they're literally within close contact for more than 10 minutes. So talk about the decision to do that, how that's going to work. Let's say Colgate has a wonderful season and they're going to go to the NCAA tournament. How does all that decision-making happen?
Well, the decision-making there, maybe this is worth a kind of context. All of our decision-making is made within a context which is far larger than the institution. We're always working with New York. We're very fortunate to have a state which gave good guidance. We're particularly fortunate to be in a county which actually worked on the high end of some of the standards. I mean, as you know, they were very early with a 12-foot line if there's physical exertion or singing involved, right? The advertised 6 feet is not adequate in many circumstances, and they were early and they were firm on that. They also were very firm on the notion that it can be cumulative time and not simply a single burst
Right.
of exposure. And my hat's off to Madison County there, because it would have been probably politically easy to take the lower standard. No one was forcing them to take that standard, to my understanding. And so the Madison County Health Department's been, I don't want to say tough to deal with, but their standards have been high. And Colgate has appreciated that and worked very closely with them. So the NCAA also was developing its standards. And the NCAA, as you know, is an institution with many layers, and some of them driven by financial interests, which are sort of beyond my comprehension. We're not there. We don't make a whole lot of money out of our athletic program. But I will say from early on, there was a feeling that Athletics, yes, we see it in the news as a great money-making enterprise. And there's the exploitation of the students, which can be questionable and problematic. At a place like Colgate, it's not so much that. It's that here you have a group of very, very gifted athletes, and a big part of their education is getting them a chance to compete at the highest level which they're capable. And in fact, stretching, right? You always want to be competing with someone that's a little better than you are. And that's educational. And the task force and the university embrace that. We're not interested in athletics for fundraising, or I can't say that it's of no interest, but our reason of not simply saying, as some schools did, we are not doing athletics, we are canceling. We kept the door open because we believe in the educational value of intercollegiate competition for our scholar athletes. But we had to wait. We had to wait on all the negotiations of the NCAA. We had to wait on the Patriot. Well, we didn't have to wait. There were layers of negotiation with the Patriot League. Brian was very active there. There were, of course, if you're in the league, some of the league is in New York, some of the league is in other states. So you had all of the requirements of moving across state lines, particularly if you were staying overnight. So it became pretty obvious pretty early that overnight trips were probably going to be very difficult for us to maintain. So it worked its way down. Our athletic department worked extremely hard on trying to work given our parameters, right? Ours were the bedrock, and then they also looked at the NCAA and, okay, that was always the question, can we make this work? And Brian was a part of that, Brian Casey. And in the end, as you probably know, the NCAA requires antigen testing 3 times a week. We are a PCR test environment. So this in a way is a supplement for that subset. And then there are various strategies that were worked out for some of the athletes are coming back in January. We have special housing for them out at White Eagle on Lake Moraine. They will quarantine, right? They don't come back, but they will quarantine and integrate that with their fitness regimen that's required for healthy competition. And it's on I guess where we are is we will, so long as we think that it is safe or within a reasonable proximity to safety, because nothing's absolutely safe, we will just monitor it constantly. And is there a chance that these students will come back, get ready for competition, and it gets shut down on Tuesday for a Wednesday game? Sure. And they know that, we know that. But it's, it's kind of like the commitment you have to make to running a class. You do absolutely the best you can with the hand you're dealt. And so we didn't choose to go with let's just shut down the whole thing. We'll see how it goes. We have hopes that we can actually get the hockey teams and the basketball teams. They have arrangements set up for the January, February period to get going. We hope that some of the other teams will be able to have, in a sense, mini seasons. It's going to take a lot of work.
Yeah.
So I'm sorry, that's probably a long answer to a
That's
fairly
okay.
direct question.
This is a broad conversation. So let's shift to, you kind of referenced with that. What are you changing when the students come back? Are they coming back at the end of January?
They are.
So what are you changing? So you want, okay, here's what we did well, here's not so much. What are you changing in an effort to make it better this next semester? And what are you doing the same?
Yeah, there are some big changes. One is just the logistics of delivering meals to rooms in January in a snowy environment we saw that as huge. And so we've worked out a system by which students will, it'll be, I don't want to say monitored, but it will be controlled in the sense they will go and pick up food and take it back during the quarantine. We had very heavy, for the outdoor exercising period, we had heavy supervision in September during the quarantine, because we can't just keep them inside the whole time. Our sense is they know now. And so there won't be so much direct oversight there. There'll be a little bit more latitude, which will soften the quarantine. Still only exercising with your roommate. That's the only person you can go out and exercise, walk, sled. We're setting up sledding hills. We're doing all sorts of things. But they will be very clear that only with what's called your immediate family unit, and then you have your extended family unit, which is the hall, but you would never go outside with anyone but your immediate family unit. And that helps us keep a pretty tight quarantine. We'll test extensively, twice again during the quarantine period. They will pre-test before they come to Hamilton. Then they will test as soon as they get here. And then they will test again after that, so that we will not release from quarantine until there have been 2 rounds of testing and the full contact tracing and identification of the close contacts and the isolation necessary. I think in hindsight, we see keeping up that regimen as the critical element, which allows us to kind of loosen up a little bit with this. They don't physically have to stay in the room. They actually get to walk out a couple times a day. So we're pretty confident that that's going to work. A huge change is, you probably didn't get down to Hamilton, quite understandably. We had tents all over the campus where there were faculty teaching classes outside.
Yeah, that might be harder.
They're not there now. So we have to make some adjustments in terms of teaching and activities, kind of the supervised activities that will be moving inside. And so we're very, very aware both of the need of that and the challenge of that. And the dean of the college staff is working extremely hard on that, as are our faculty and others. So those are big changes, but in some ways the change that if I get to talk with you after the spring semester, the one that I hope we'll chat about is one thing that we realized, and I would fault us here. I'd fault myself and those of us. We kind of trusted the students to come up with the social alternatives, the way to run clubs in this new environment. We didn't want to dictate how that would happen. And so we gave them space, but I think that wasn't reasonable. To go to someone who's 20 years old, they've done things certain ways for 20 years, and to say, well, you figure out how to adapt to this new situation, ones that you haven't really made the rules about, the ones that really are new to everybody. So we're going to be much more proactive in trying to cultivate within a safe environment the extracurricular activities, and be, in a sense, not waiting for them to come up with the solutions. Previously, what we did is we provided kind of administrative screens where they would come to us with a suggestion and we would say, oh, well, revise it this way. We realize now we need to say, well, here's some ways to do it. Here are 5 templates as to how you might adjust, and get that word out and really help them to have that part of their life be richer early on in the term. So that to me is going to be the, can we do it a lot better in the spring? That's where I hope we really do a lot better, because so much of college learning is well outside the classroom. And that's one of the reasons we have residential colleges. It's one of the things that we value. So that's a piece that we're hoping we can do much better in the spring.
I know you had some stuff you wanted to show us in terms of data. Do you want to go ahead and kind of explain that and show that to us now?
Well, I can. And this was, I mentioned early, one of the things that we did was to be that we were data driven. And we created what was termed the HAT, the Health Analytics Team. It involved the doctors, it involved campus safety, it involved people from all over the institution. There were about 20 people involved. And they created what was called the Health Analytics Dashboard. And let me just share this with you. Let's see if this will work. I'm going to share my screen. Let's see if I can do this. Here we go.
Okay.
So you should be seeing something that says Colgate Metrics.
Yep.
Okay, and this was available on the website. It was available to the entire community, and every day the measures would come in, and for example, you can see right now our concerns are for the regional health issues, but that's a huge part of judging. Can we go to a more liberal gate, or do we need to back up? And we actually just backed up last week. Or was it 2 weeks ago? We went from our most open gate back to gate 2 based on the regional. And so the health analytics team looks at data every day, enters the data, shows trends, right? So that here we have, if it's going up, there's an increasing alert at the Community Memorial Hospital. The county infection is high and sort of stable. So this is a way of letting us know. During the semester, there was a lot of concern. I hope my cursor is, you can see my
over
cursor.
the commitment violations.
Is it there?
Yep.
Yeah, commitment violations. This is where we measured who was, how many problems did we have? Behavioral problems, both reported and in a sense confirmed. And there were times where that was trending up, and that was a concern because you had to decide based on previous data how the next week, would we open up the following week? And so this gave us a sense, and the community a sense, that it wasn't an arbitrary decision. It wasn't being driven by the treasurer. And then you could follow down, and they would have updated every day the analytics, and it would roll through both local and all the regional counties, so that we decided that we would provide as much information as we could within the community for those who wanted to track it. And we could always turn to this because we knew it was accurate when members of the community were alarmed about something that might come in over the the internet. You could actually open this up and begin to say, okay, well, here's actually what we're talking about. This is the data. This is what we're monitoring. And I think having it available, it's very easy for an institution to say they're data driven, but having this here, I know having it as a member of the task force, it gave the community confidence that it was indeed data driven, or at least data available.
Okay. So this will be my final question. We know that we were pretty stable until shortly after Halloween, when everybody went to a Halloween party. And when I say everyone, a good portion of people, and we had a much larger spread again. And then things kind of stabilized, and then we had Thanksgiving, and we've gone up very, very significantly. And you referenced that we've stabilized in the last week. We were over 430, 440 cases. We're back down. We've gone down about 10 to 15 every day for the last 6 to 7 days. We're back in the mid 300s. It's probably going to continue to go down until we anticipate having a large increase again following Christmas.
Yes.
Which means right about the time you're going to be bringing students back, we're going to be probably in the middle of this significant uptick again, which you would anticipate lasting into February, because you have that first phase, which is the initial cases. And then it's that next wave of exposures until everybody realizes we're not good. And then we all kind of tighten down again. So my question to you is, knowing that it's a pretty good chance you're going to be returning to campus in a upward trend, let's say, not just with your students, but probably locally too.
Yes.
What are you doing to go, okay, we're likely going to see this happen. How are we going to mitigate this to the best of our abilities? And I know you're doing the pre-testing and the testing when they get on campus, but it's not just that, it's also the local folks. And just what you said, it's your employee was trending, your employees. You're going to have employees that are going to be around these kids, and the food delivery people and the food preparers and all that stuff. So what are you guys doing to mitigate that? At least try to mitigate that as much as is realistic.
Well, let me, and I don't want to go too long because but it's a really interesting question and a really useful one, because I think in answering it or responding to it, I can, in a way, outline how none of the decision-making process for something like this can be done in isolation. There are lots of factors. And so, again, let me sort of bring in another piece. And that is that one of the data points that we got from the fall semester is that a semester without a break is it's outside the habits of both faculty and students, and it creates enormous stress. So what we built into the spring semester was the latitude of introducing a couple of what we sort of called holidays. Our first thought was, okay, it'll be announced. You can't do these as a surprise because there might be a test or something on a given day. So it was got to be great if it was a Tuesday and a Wednesday, right? Break up a week. It gives, but there are problems with that. In the sense of 1 day a week seminars and various things. And secondly, another factor came in. We were committed to bringing 2 or 3 of those in to the spring semester. So when? Well, I actually first thing I said is don't put it on a weekend, because that creates a 3-day week and that's just an invitation to travel. And that's what kept us safe. That was my first reaction, right? Gut reaction. But we then looked at exactly the point that you made. How likely is it that we're actually going to open in the 20th or around the 20th of January? So we need alternate opening dates where the logistics can be up and going. And we need a 3-day window to open. That's to bring them in, to test them, to get them in their rooms. So suddenly my concern on Friday is, in a sense, absorbed or overwhelmed by the logistical need to create. We actually have 2 alternative entry dates where we will be able to anticipate what the national situation is in January. We may decide to say, okay, we're going to start classes, but we won't reopen the campus until, I believe it's February 14, 16, something like that, a couple weeks into February. And then if things are really bad, maybe not until into March. So we took those 2 holidays, put them on Fridays, created these 2 moments, both to give people a break, but particularly to address the concern that the very, very real concern that you have, that we would love to open in January. We're working to open in January. Am I going to bet my house that we're going to open in January? No. So, that's how all these factors, and that's what I've found so positive about the leadership in association with this year here is, lots of factors come in, all elements are listened to, and then you work out something which might not be anybody's ideal, but it's clearly the best decision that we can make. So that's a long way of saying we've thought very hard about that. We will be aspirational. If we can open in January, we will, because we're convinced that the fuller experience here will be positive for the students. But we're not going to put the community or the students in the college and the college community at risk just to say, oh, we committed to opening in January and we're going to open in January. We won't open if it's not, if all the health analytics don't say this is a reasonable decision. And we have a wonderful, I don't know if you know Doc Miller down here.
I'm not familiar, no.
Okay, she's been our physician for years, and Ellen Larson, who's coming in as her assistant, she's a wonderful doctor from down. They are tough. The whole health analytics team, they let us know what the situation is all the time. And so we're very fortunate there. We won't open unless it's a very,
it's
very
just such a
positive decision.
Yeah, it's such a fluid situation. I mean, the county closed, I don't know, the first week or so of December. They had, what they said was, if you can work from home, go home and work. And then they've done the press release a couple of times now. You can't go into the building unless you have an appointment, and they're at half staff. And there's a lot of reasons you do that. Just what you said, most of which are based on the health and safety, but also in case something does happen, hopefully you have some other folks that might be able to come in and help that are working from home right now. So you kind of look at this stuff and go, whew. And again, we're all projecting, we're making this assumption right now, based on analytics and science and human nature. People are going to get together for Christmas. It's just going to happen. That's part of life. We're recording this on the 2 days before Christmas. And even if it's small gatherings, it's gatherings, and that's where it's going to spread again. And, it'll be interesting to see, how we go from there. And, I thank you for your time, Bob. It's always good talking with you. I will absolutely be calling you at the end of the semester.
Okay.
And hopefully we have the same conversation in that you were successful, as successful as you can be, because there's just no way to get around. It's here. It's everywhere.
Oh, yeah. The worst thing that we can do is put our heads in the sand and pretend that somehow it's not happening.
Right.
So
So I look forward to talking to you again.
Yep.
Thanks.
Been very enjoyable for me.
Yes, we will be talking to you soon.
Okay. Take care, Matthew.
Yep.